Hi friends, today we are going to discuss leave of absence under Mental Health Care Act of 2017. I am Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic purpose only. This is not a legal opinion. If you would like to have a legal opinion, please do contact an advocate. Conflict of interest, none. Mental Health Care Act of 2017 was passed on 7th of April 2017. Today we are going to discuss about leave of absence, that which is dictated under section 91. The section 91 clearly says person in charge of mental health establishment may grant leave to any person with mental illness admitted under section 87, that is minor, or section 89, that is supported admission less than 30 days, or section 90, beyond 30 days, to be absent from the establishment subject to such conditions, if any, for such duration as such medical officer or psychiatrist considers necessary. And before doing this, the medical officer need to take an application, that is from form I, from the NR or the person with mental illness. Please do understand, leave of absence is, although he is admitted in the hospital, he is not been discharged. He has been given permission with certain condition that you have to take medicine, you have to do regularly ABCD homework. Those are the conditions has to be fulfilled. And then once for such a duration, once it is done, he has to report back to the hospital. This is not discharge, it is a leave of absence from the mental health establishment. This is the form I, the NR need to fill this. And if the person is a minor, again, the legal guardian or the NR need to fill this. At the same time, there is something called as section 92, that is absence without leave or discharge. That is basically a person is absconding from the mental health establishment. This section is applicable for patients who are from prison or prisoners with mental illness. That means this person has been admitted directly from the prison to a mental health establishment, and he absconds from if he absconds from the mental health establishment, then the mental health professional or the medical officer in charge will report to the police. The police will search this person, will bring him back to the mental health establishment or to the prison. So please do understand, section 92 is applicable for 103 only. And when the mental health establishment, the medical officer in charge has to give intimation to the police under form J. This is how it looks. It has to be addressed to the station in charge, police station, and he has to fill all this information. However, the Mental Health Care Act is silent regarding a patient who is section 86, that is independent patient, 87, a minor, 89 and 90, supported admission, patient absconds from the mental health establishment. That means Mental Health Care Act is very silent. What should we do? They are not prisoners. That means you need not inform the police. That is what is clear. But however, you have to facilitate and discuss with the family members and the nominated representative to contact police to trace the person with mental illness if he had absconded. And please do provide a certificate that he was admitted from this date to this date and what was the dress he was wearing when he absconded from the hospital. So this is the good practice. However, there is no obligation for the psychiatrist or the mental health professional to lodge a police complaint under the mental health establishment. To conclude, leave of absence to be used judiciously before discharging a patient. Suppose a person is severely ill and now he has been treated, he has improved, but the family is very apprehensive or the NR is apprehensive that if he goes back and he becomes violent, then a trial can be given to go home or to go and to celebrate a festival if it is nearby during the admission and come back, and the family members becomes very confident, they can take discharge and use this clause to help the family members. And if you like this video, please do subscribe to my channel. My channel is youtube.com C Suresh Padadmat. Thank you very much for your time. Stay safe.